Hi, I'm Sarah Smith.
And I'm Sharon Silverman,
And we're with the GDRA,
the Genetic Disease Research Association.
And today we're here to talk about spherocytosis.
Spherocytosis is an inherited red blood cell disease in which the red blood cell's shape changes. The shape changes from a sleek, flexible donut shape to a round, plump sphere.
And now Scott Seymour with symptoms and causes of spherocytosis.
Thank you, Sarah. And now for the causes of spherocytosis. Spherocytosis can be caused by 5 different genes. The main one, which causes half of the cases, is called ANK1 gene. You should call your child's pediatrician if your kid shows any of the following signs: restlessness or irritability, having difficulty feeding, sleeping too much, red abdomen, pain between shoulder blades, pain in your right shoulder, paleness, fatigueness, shortness of breath, irritability, muscle weakness, increased heart rate, dizziness, lightheadedness, jaundice, sensations of heart palpitations.
Treatment options include blood transfusions from a corresponding blood type, which are necessary if the red blood cell count gets too low. However, this isn't permanent and more treatment options may be required. A splenectomy is an operation to remove the spleen. The spleen is an organ that produces white blood cells. Although this will solve the most serious problems to do with spherocytosis, it will also weaken your immune system to an extreme, so take caution. It's important for people who suffer spherocytosis to take folic acid supplements due to low levels of chronic hemolysis. Also, make sure to watch for gallstones, as that is a danger prevalent in a lot of victims of spherocytosis.
Hereditary spherocytosis, but there are treatments depending on the severity of your symptoms and how much you'll have to receive. The most common treatment for hereditary spherocytosis is a splenectomy, the removal of the spleen. Due to the fact that your red blood cells begin to damage the spleen, a splenectomy will cure your anemia. Keep in mind that your red blood cells will still have their spherical shape, but they will live longer. The removal of the spleen can also prevent the development of gallstones. However, not everyone with this illness needs to have a splenectomy. Your doctor might think better measures that are suited for you. For children under 5, surgery is not recommended. Your doctor might recommend a daily dose of oral folic acid, a form of B vitamin that your body needs to produce red blood cells. You may need red blood cell transfusions if you have a severe case, or your doctor might treat you with light therapy, also called phototherapy. Your doctor might also treat you with preventive antibiotics that can help with spherocytosis. This treatment option is very common for children.
Although spherocytosis is uncommon and no famous people are currently known, spherocytosis is found in 1 in 2,000 people. About 2 to 3 in 10 people with spherocytosis have mild disease. They will be losing red blood cells, but their body will be able to replace them quickly. They may in fact have no symptoms. About 6 to 7 in 10 people with spherocytosis have moderate or severe disease. Half of these are first diagnosed in childhood with anemia. In the United States, approximately 1 in 5,000 people have hereditary spherocytosis, born with the disease, and it lasts throughout life. In 1871 and is the most common case of any inherited hemolysis in Europe and North America within the Caucasian population. With an incidence of 1 in 5,000 births, the clinical severity of spherocytosis varies from symptom-free carrier to severe carrier because of the disorder. It exhibits incomplete penetrance and
The other genes that can cause hereditary spherocytosis are the EPB42 gene, the SLC4A1 gene, the SPTA1 gene, and the SPTB gene. The mutation that causes hereditary spherocytosis is deletion, meaning that one of the base pairs that code for the protein ANK1 is deleted, causing it not to work properly. Around 75% of cases are inherited through autosomal dominant genes, but there are 25% of cases that are inherited through autosomal recessive genes. Occasionally, a new mutation will occur, causing someone with no family history of hereditary spherocytosis to get the disease. ANK1 stands for ankrin 1. Ankrin 1 is a protein made by the gene ANK1. Ankrin 1 is usually found on the cell membrane. This protein attaches itself to other membrane proteins and gives the cell stability and shape. It also gives the cell flexibility and allows it to change shape in order to pass through narrow blood vessels when traveling throughout the body. Hereditary spherocytosis is a debilitating disease that can affect many aspects of a person's life. It can affect people physically, like jaundice, and it can affect the rate at which people get other diseases. Hereditary spherocytosis can even be deadly. Please call 770-880-3434 now and donate to the GDRA to help us find a cure for hereditary spherocytosis. Thank you.